Hi, everyone. I'm Neil Arya. I'm guest hosting for Meta Spencer today for the Project Save the World broadcast. And I've been guest hosting a couple of times a month in the last few months. And I'm chair of the Pegasus Institute for Peace, Global Health, and Sustainability. And I have a couple of people who are part of our Emerging Leaders Network with Pegasus and are real go-getters, I think, for young men. And I thought bringing them together would be really great. We'll also have both of them together for our conference at the beginning of May, the Pegasus conference, May 1st to 3rd. Hopefully some of you will be able to join us. But this, for me, was an opportunity to get to know these two fine young men a little bit better. So welcome, James and Dean. Before we get started, could you each let us know where you're calling in from and why?
Yes, my name is Dennis Opondo. I am a medical doctor working currently in Kenya. So I'm actually joining from Turkana, which is on the northern part of Kenya, where we are basically it's a refugee hosting area because I do work as a health manager at one of the refugee operations that is operated by Kenya Red Cross. So I'm happy to join you today and happy to have this discussion. Good to see the whole team and James too.
Thank you. And hi, James. Where are you calling in from?
Hi, my name is James Achuli. I'm from South Sudan. I'm currently in Montreal, doing my master's at McGill University. And so, yeah, I'm calling from Montreal.
And what is it that you're doing your master's in, James?
I'm doing my master's in political science, and my research is going to be on refugee studies, and I'll be doing that data collection in the summer.
Yeah, thank you. And yes, one of the themes that's going to be important for our conference is the theme of migration and refugees. And each of you, we thought, could bring a very personal perspective to what is happening internationally.
So I was born in South Sudan, and a place called Tali, which is, I think, over 100 miles away from the capital city of South Sudan, Juba. But then I moved to the capital around 2010 to study, and just after independence in 2011, 2 years after independence in South Sudan, 2013, we had that civil war, and so I ended up being displaced. And then in 2015, 2016, there was also another war that again broke out in South Sudan, and I ended up going to Uganda, just joining a moving crowd, and I ended up in one of the largest refugee camps in Uganda, Bidibidi refugee settlement, which is actually in northern part of Uganda. But I was relocated from that refugee camp, and I ended up in another camp called Chiriandongo refugee settlement, just 5 hours away from Kampala, which is the capital of Uganda. And from there, I was fortunate enough to get a high school scholarship to study in Armenia. So from 2019 to 2021. And then after that, I got a scholarship to study my bachelor's at the University of British Columbia here in Canada, in British Columbia, which is the west coast of the country. And so I graduated last year with a bachelor's in international relations. And then I applied for another master's scholarship at McGill, the McCormack Baines Scholarship, and that's how I ended up in Canada. So I think my journey pretty much shaped why I'm studying the program I'm studying today, because I grew up in the intersection between government and NGOs, and I've seen the work that they do for me and my community. And so I was inspired as a kid to sort of pursue that path. And I enjoy working with refugees. I've been helping not only myself as a refugee, but my fellow refugees back home, but also those that are newly resettled in Canada. Yeah.
Well, I was born and brought up in a region around Lake Victoria, which is on the western side of Kenya. So I am from a community that is called the Luo community. So basically, the community that lives around Lake Victoria. So that's where I was born and raised. I also got an opportunity to go and study in high school, which is in the capital city of Kenya, in Nairobi. And then from there, I joined Kenyatta University, which is also based in Nairobi. So just through my journey in medical school, I got very interested in peace and health and the intersection of peace. So I think just getting through a movement called Medical Students for Social Responsibility, I really came to understand the impacts of peace on health. And this was specifically through a course that I did that was called Medical Peacework. Around that time, as medical students, there was a lot of tension around Kenya at that point. So most of what we were involved with was trying to educate people on peace, try to educate medical students on peace, and also trying to probably link doctors and other health professionals who are working in the health sector. As a medical doctor, I joined now the umbrella organization that is called Physicians for Social Responsibility, also goes by the name International Physicians for Prevention of Nuclear War. I ended up working in a medical facility, just like everyone else, once you graduate as a doctor. I wasn't satisfied with what I was getting out of my career as a doctor within the confines of a wall or the hospital wall. So that's when I got interested in specifically public health and got a lot of interest in refugee health. And that's how I moved into the refugee camp, which is currently where I work. And that is in the northern part of Kenya, which hosts a number of refugee communities from South Sudan, from Sudan, from some asylum seekers from Uganda, and basically all the countries around Great Lake region, Horn of Africa, and Eastern Africa.
Both of you are a little bit the exception in terms of the communities you grew up in. And I wonder that for James, even though you've had some misfortune in terms of being a refugee and the various displacements, but what is it that helped you get to where you are versus some peers who'd be perhaps equally intelligent? And
yeah, that's a very good question. I think it has really to do with the community I grew up in, also family. I think that certain things push you to kind of grow up very, very quickly. I kind of realized that at a very young age because, again, growing up in South Sudan and being born in the early 2000s when our country was going through the civil war, I remember my parents would always encourage me that if you study really, really hard, you will succeed and you will, save our family, So I was a kid listening to those stories, and I kept those stories in my heart, and I was pretty much determined to go to school. And I think that for the story changed when I was introduced to school, and I went to UNICEF funded schools as an internally displaced person. And I realized the value of school and the joy that comes with, playing around with my friends and just seeing, the value that education brings, especially looking at UN workers and just the amazing work they were doing. So that was like the first thing that caught my attention as a kid. But I think that also, there are opportunities, but those opportunities also, I think, required one to be prepared. And I think that I was prepared to kind of just take on every opportunity that was in my way. So when I went to the capital city, I was with my sister. I lived with her, and I was pushing to just continue with my studies, even though there were no school fees. I would kind of hustle around. We had this thing. It's like similar to ice cream. I would go collect plastic. Sorry, Chris, I would say it's not plastic bags, but we would normally tie them in containers and then we put them in a freezer, and then you would go and sell those things to make money out of. It's like a small business basically, just to kind of pay for my own school fees, and some schools allowed me to study, and then they would see that I was doing well, and then they would give me a scholarship, and that's how I ended up actually in the southwestern part of South Sudan on a full scholarship before, again, fleeing my country to Uganda. And even in Uganda, I was studying also under the support of UNICEF and those UN funded schools, but still very, very difficult because you don't have access to all the basic needs and all the necessities that are required for success when it comes to school. I'm talking about maybe breakfast, food, even family to kind of support you was not there because I was like an accompanied child when I arrived at the camp. But again, I had that burning desire that there is something out of school and out of determination. How I ended up going to Armenia was, again, working hard and doing my exams and passing, and learning how to apply for scholarships online. Even though we didn't have internet cafes in my refugee community, I would run pretty much every day to an internet cafe, which was 10, 11 kilometers away one way. You just kind of determined to do that. And I did that for a long time before I landed online on an article that was published by UWC, United World Colleges. But again, I'm one of those people who like to look for opportunities even in the dark moments.
So my journey was well, I can link most of my interest around peace and health to one particular experience that I had, which was around 2007 when we were actually displaced from where we were due to post-election violence. This was one of the worst post-election violence that we've actually had in Kenya following disputed presidential results. But at around that time, there was a lot of movement because of ethnic incited conflict. So I think that was, for me, that's when I realized, because there was around 3,000 deaths that were reported at around that time. And I actually saw it, I saw it happen. And I had one of my friends who were just possibly playing with outside of where we used to live. And we had to attend his burial probably some 2 days later. So I think for me that was a turning point, and I realized what exactly war can do. And then I came across these student affiliates that were basically preaching peace and giving medical students a chance to be kind of peace builders. That was for me, that was the call of duty, and I think that's how it began. And it's like I always find something better to do, and I wouldn't say it. It's just it's a lot of interest for me because most of what I do is basically not it's not paid or it's not reimbursed. It's just things that I've always done out of interest. And when I also realized that I could also be the one who impacts probably the lives of other medical students by probably teaching them about peace and health, then I realized probably this is something that I would want to do for a long time. So, like currently, I ended up being like I have a cohort of medical students. For me, that gives me something I would say it's pure joy for me to see that happen. In my position, working as a health manager, I have seen actually, I would give an example of just the population by itself. Around 67% to around 70% is made up of women and children. Or so the young population makes up around 70 to 80% of the whole population. A lot of young people who actually have a lot of potential. One of the empowerment programs that we currently run as Kenya Red Cross is we do have a refugee-led organizations that sort of builds the capacity of what we would call nursing assistants and clinical assistants so that they can support the daily day-to-day running within the clinical facilities. The reason is, of course, since I joined this space about 3 years ago, what we've seen is that the funding situation keeps on worsening. And of course, that would mean that we have to reduce the qualified or the national personnel because of affordability issues. So then what should you do in that case? So what we've planned to do is sort of build the capacity of the population that is there. And of course, there is a lot of health concerns around the population. I've almost dealt with possibly 2 outbreaks of cholera, an mpox outbreak, and measles and polio outbreak. Some things that are not too common in other regions. This is basically because of the health systems that have failed due to conflict in regions where they come from.
Now, James, I see you as an observer, that you've had a lot of experiences and you observe different cultures, different ways of thinking, trying to get into the heads of people, I think. And I think that helps guide you and may have guided you into, as you look at your future work academically, now doing your master's. You do speak a number of languages, and you might be able to tell people about that. So you've acted as an interpreter for people who have been resettled in Canada or are claimants here. Could you tell us a little bit about your life experience in Africa, migrating to Armenia and then Canada?
When I came to Uganda and I was there, of course, when you arrive as a new person, the government and the UN basically they step in and they help you out. But what I've noticed is that the more you live in the camp, I think the more they have this self-autonomy type of thing that they believe that you'd be able to cope, be able to provide for yourself and not entirely rely on the UN. So this is some observations that I noticed, but I think that it's a little tricky, because just because you get a piece of land doesn't mean you're going to be like self-reliant. And so when I say that the refugee sort of regime has to be, people need to rethink about it, because it's no longer the 1951 convention law anymore. So what I meant by that in our previous conversation is that a lot of South Sudanese that come to refugee camps like Chiriandongo or Bidibidi are mostly women and children. And people wonder where their husbands are. And what I have seen, at least, is that either the husbands are in South Sudan, or in some other place, and they or like fighting. And what they do is basically send money to these people that are in the camp, the children and the women. And so that has, I think, allowed many people to stay in the camp. When I went back to Uganda in 2023 to meet with my mom, I noticed that a lot of people that I came with, or a lot of friends that I used to live with when I was in the camp, had gone back to South Sudan, because remittance and the support growing food crops in the camp is not very sustainable for them, because the land they get is not enough. So yeah, that's one thing that I've seen, and I see that, and I understand why there is this model of progressive model in Uganda, but I think that it's a little bit problematic. And yeah, I think shifting the responsibility from like the state to the refugees is a little bit of a stretch, because we can't be speaking about self-reliance when the education system cannot really teach you to get employment opportunities, when the health system is basically very, very slow. And I think that is something that we kind of need to think about. I think Canada is doing a great job, but still, even the private sponsorship program here in Canada, it's a little difficult, because it's like sort of neoliberal in a way. And I think that refugees are very vulnerable. Yes, we can bring people as permanent residents to Canada as private sponsorship, but I think there is a general, there's need to be guidance, and make sure that when we leave refugees to be on their own, they should be strong enough to stand on their own. Yeah.
We are tasked with the responsibility of pushing a sort of what we call an integration plan, or in the local context, we call it a Shirika plan. So basically, the Shirika plan is it's kind of a government led plan, of course, with support from UN agencies, to sort of build self-reliance to the refugee community, because basically what we have in Kakuma at the moment is what we would call a protracted emergency. It's been there for roughly 30 plus years, and it for the government it got to a time where they're trying to see ways and means of putting this population into work, putting up businesses, putting up all these kind of economic opportunities that would allow refugees to be self-reliant. But the problem, especially where we are, is I'm happy to hear that from James Sechuli's story, Uganda actually offered land. But what the reason why that might actually be very impossible, and of course, with the Kenyan context has been compared a lot with the Ugandan context, and this is because the Ugandan context has like Uganda tends to have a lot of fertile land that could basically is arable and could promote a lot of agriculture. That's very contrary to what is here in Kenya, because this basically is a arid and semi-arid area. where plants wouldn't grow, and where there's no, I mean, people are moving with their livestock to find pasture in distant land. So basically, there's not any economic opportunity within most of the Turkana County, and that puts us in a tough situation where we're just wondering. Of course, you're saying you want to build self-reliance. It's sort of a good plan, yes, but of course the implementation is still very, very challenging because most of the economic opportunities that are around this place are not feasible. So I was just listening in to James, and I totally get where he's coming from. Of course, the deeper you try to understand where or why there are conflict, the more you find out that it's actually, I would, for lack of a better word, I would call it more of a systemic rot, sort of, and it's just a political interest that are kind of divergent. It's unfortunate, but if someone has seen war for quite like their basic or the formative part of their lives, then it's very hard to kind of preach peace, and it really takes effort for you to actually sort of make this peace to kind of bring positive or have a positive impact to the population. So from my experience and from how I see it, I think it's most of the conflict has a political attachment to it, and of course, um, this most of these wars are then funded by some other interest or external interest. I would say those are the inner causes of why these conflicts happen and why it's very difficult to stop them completely. And there's also, of course, there's also an issue on climate change, and that is why, for me especially, and the work I do around peace and health, the aspect of climate crisis has become very, very key in some of this discussion, especially because a number of communities that are based within the East African regions are actually pastoralists. So, of course, we've seen a number of conflicts that just come from pastoralist communities, and because of the changing climate, they're trying to look for pastures, and then they possibly end up in a round of scrambling for some pasture that can't fit or can't be enough for most of them. So that is basically the two things that I would say is the reason why we continuously have conflicts in this setting. People struggle to find that connection between peace and health. So from the teachings that I've done, I've seen people who have committed to really work in the humanitarian space, a space that previously has had very little interest from especially medical doctors. So now what I'm seeing is for around the 10 generation of medical students in Kenya that we've seen graduating, we see most of them are actually interested in not just doing the normal clinical work where they're based in city hospitals, but they now move into, there's a lot of interest in humanitarian work and a lot of health related humanitarian programs that kind of serve these communities that are in conflict. So that is the value that I've seen in terms of just creating awareness and also building a sort of pool that can chip in into peace building activity with just the health initiatives.
What Dean has been saying is pretty much spot on. I think I come from a very small tribe in South Sudan. We call them Mondari, and I'm also we are nomadic pastoralists. So that because of climate change, I see that there's also a lot of other tribes that are basically nomadic pastoralists. There are intercommunal conflicts that really come with the climate change crisis, and I think that because of the bigger war that has been going on in South Sudan, those conflicts are usually between groups and tribes. And so even if you're displaced and you're a refugee, you're living in Kakuma or you're living in Chiriandongo, you still carry those memories with you. It doesn't really have necessarily to be with, it doesn't have to be you fighting, but it's just the general knowledge that your tribe was fighting against this tribe because of, getting into their land and grabbing their land or consuming their pastures. And so that I think that is very, very spot on. I think our leaders have kind of lost vision of what the country is kind of headed, and so it's come down to basically it's me versus them, and I think that our country needs a lot of education to understand that you don't really have to be in politics. You don't have to take up guns to be able to have food. I think that there's a lot of opportunities in the country, but our leaders, because of the fact that they just forgot the vision of what the country, where the country should be going, they have failed to provide the environment and the platforms that will sort of diversify the economy so that young people don't have to just take up guns and get manipulated to join the army and fight a war that basically benefits the people in power. External factors, I think that's a big one, because our country basically without external influence, I don't think we would have gotten independence from Sudan. There are countries that played a big role in that, and I think those countries would basically try their best to make sure they get what they want because of the fact that they helped this country get independence. And I think that's a big issue that I don't know how to deal with that, especially right now. There's a lot of things in play. And what you shared about people even like fighting in refugee camps, it is a very common thing as well in Shiriandongo, where I grew up. Anytime there is, we have a situation currently in Jonglei State, and also I think part of Upper Nile State. And my mom is currently in Boyali, and she tells me about what is going on between these major tribes. And the fact that they keep fighting each other, killing each other, even in the camps, because of what is going on in South Sudan. And so, yeah, you're absolutely right on that. But it's definitely helping. Like I am here helping my family back home, but I don't think it's sustainable in the long run. I think what we need to understand is that we don't want to be managing displacement. I think we kind of just need to work on stopping like displacement in the first place, which is going to be very difficult. I think that's a bigger solution. Instead of relying on, because remittance are not reliable. It's not like very predictable. It's not going to come in at the right time. It's not like the UN system where, in the past, where there is monthly ratio and things like that. Remittance are also, I know that culturally speaking, from a South Sudan point of view, we are our relatives, our loved ones, even though not biological, you're sort of entitled to get something out of them. Like I am here, my relatives, my uncles down, I don't know, they basically feel entitled to get help from me. But I think that is something that is not sustainable, and it's actually causing a lot of troubles in the camp. A lot of people it's giving up and developing these conflicts even within clans and families. So that is an issue there as well. But I don't think also like general relying on aids right now is something that is sustainable unless we get some changes in leadership in the global stage at some point. So I think that yeah, solution wise, you just need to find ways to like stop the wars. And I know that's easy to say, but it's really, really difficult to implement.
We've heard about the cuts with USAID and other things, even in terms of disease management with PEPFAR. And just wondered if you could talk a little bit more about the impacts that you've seen.
So it's a very good question, and it's a question that I actually have to deal with every other day. So what I would say is the situation now within the refugee camps, I would say it's chaotic. I mean, it's chaotic to a point where we are actually having refugees going back to their countries because they're saying we came here for help, but clearly life is worse around here. So you'd rather just to go back to our homes and die there. And it's actually very sad to hear them speak about how they had hope when coming to some of these refugee camps, and now it's gotten to a point where you're actually trying to do your best as the partners or partners in health who are working within the refugee setting. You get to a point where you basically have very basic medicine, and it's not sufficient to sustain the population that, of course, keeps growing because the conflict never stops. So the population is growing, funds are reducing. So basically, it's a sort of situation that the demand is increasing, but the supply is definitely reducing, and it's reducing drastically. And drastically means, I mean, funding has gone down by around 60%. So this would cut across healthcare, it would cut across food rations, it would cut across livelihood opportunities that were possibly going to allow them to be resilient. And this is the situation. So now what we are seeing is we are seeing more mortalities, we are seeing more morbidities, we are seeing probably in the reproductive health, we are seeing women who are losing their children in the process of birth. We are not able to sustain the community health initiatives through capacity building of the refugee population to be able to take care of themselves or to identify some of these cases, and also just be able to reduce the burden that comes to the health facility. So the situation currently is very dire, and we are getting into a situation where, of course, around two years ago, we had a hope of probably integrating the refugee into what we call the national health insurance system, but that has been politicized, and now it almost looks like it's going to be impossible. Another issue is that we previously were really working hard to ensure that most of these refugees have documentation. Now the organization that was actually providing documentation is basically has been destabilized again due to political reasons. So you don't have a refugee ID, you cannot enroll onto the national health insurance system. You cannot access healthcare anywhere else other than the camp. The camp does not have enough facilities to actually provide some level of care beyond primary level of care. So whatever is there is it's a state where we are holding on to the hope that probably we'll be able to integrate the refugee population into the social amenities and the social systems. But on the other hand, there's a lot of resistance from the government and the partner. So now a lot of interest is being put into the developmental perspective rather than the emergency part. So most of the donors are now looking into, we're not looking to move you to another place. We are looking to build you where you are. And that, of course, also has a challenge because, again, from how it's been, a lot of refugees, while on the move, the end goal or the point where they'll feel they have moved out of this usually is when you get resettled or when you get to move into a new country and you're able to enjoy some of these opportunities. So now you're moving to seek asylum in, say, Kenya, but you're not able to proceed beyond Kenya. So it becomes a very frustrating state for these refugees. And of course, there's also been a lot of misinformation about the government trying to nationalize refugees. And all these conflicts and confusion is making the whole situation to be a whole lot difficult than it should. Well, we are hopeful that probably in the next few years, again, if what we call the Shirika plan or the integration plan works, then there would be an opportunity to actually be able to sustain this population. But I would say this is work in progress.
I hope that for the two of you and for many other people, we'll be able to discuss more of these issues when you come to Waterloo for our conference and engage other people with some expertise.
Well, I think that this is such an important topic, especially given what is going on. And it's going to be our responsibility to find something, to find solution. And the fact that we have platforms like this and spaces like this to talk about displacement and migration and refugees gives me hope.
Trying to deal with the movement is not sustainable. Trying to deal with the refugee situation is not sustainable. The only sustainable way is just to stop the war at the source or where it's happening, because that is the only that I think would be the only possibly the only solution to end all of this. So I'm happy that we are able to have these conversations, and I mean, probably just having these conversations over and over again is just a step towards finding some solutions that then pushes towards what we would say is the final solution, which is ensuring that there's peace within these countries.
Thank you both for sharing your experience. And Dennis, at the end of your day, James, just before your class. So we appreciate your being here at this time, and I look forward to seeing both of you in person.
Thank you. Thank you very much.
Okay. Bye for now.
Thank you. Bye.